AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, for every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health. For each day you'll find current medical news, knowledgeable guests, and fascinating health topics, and of course, where we do encourage you to call in to join in. Today, well, it is a Friday version of the show. It is a get 'em up, out of town version of the show in the strictest sense of the word. We're going to open it up to you today. I've got a number of things I can bring to you. You can bring whatever you'd like to us and allow us to comment and maybe answer those questions that you might have. To do that, as you would well know, give us a call anytime during our show today, 412-825-6262. That's 412-825-6262. It is an open phone roundup today as we get them out of town on this chilly Friday, but soon to be, I'm told, listen to the bell, a pretty nice weekend for you to enjoy. Now, as we move on in this month, we're going to have a blowout final week. As we move into the next week. So it goes something like this. On Monday, a new guest. His name is Lou Paradise. What a name, by the way. Love that name. Lou's going to be talking about goodbye to pain pills, goodbye to side effects, and as I read the workup on him, evidently has an approach to using homeopathic pain relief, or at least that's what I'm deducing from what I can read here. Anyway, you're going to be wanting to stay tuned with us on Monday when Lou Paradise discusses how to say goodbye to those pain pills and, of course, to the side effects that accompany them. Then in keeping, it's been a while now, it's been a few months since we've been able to have the Freedom of Choice in Cancer Therapy guest as a part of our show. We're absolutely going to work toward that this particular month, however, because they do meet up at Butler on Thursday. It's a little bit out of sequence. It's the fourth Thursday of the month. We can just lose track of that. But, the third Thursday thing doesn't work out too often. But it's the fourth Thursday. It's going to be on the 27th of October, and it will be at 7 o'clock. It will be at the Days Inn, right there on Route 8, going up about a mile south of Butler. And the guest name of Janet McKee. Now, Janet is a local girl, from what I can tell here. She's heavily involved in alternative management of various kinds. She is touted as a holistic health counselor and a whole bunch of accolades that of various committees and so forth that she participates in. I look at the vast array of things that she treats. It literally is an encyclopedia of alternative approaches to treatment of you. We'll have Janet McKee talk to us on the show on Wednesday. She'll then be the guest, the featured speaker on Thursday up at the Freedom of Choice in Cancer Therapy group. Then, of course, on Friday, well anticipated as it is, David Brownstein finally comes back to us to discuss the book that he wrote over the summer. We have talked about it immensely, and we'll be able to finally get into the nitty-gritty of what he refers to as the soy deception. Evidently, there is a deception out there. He's uncovered it, and as he usually does, he does a bang-up job in bringing these controversial items to you. His book's easy to read. You don't have to be a medical person to do it. And, of course, this is one of many. It's a total of 10 now. We're on our third book with him, and we'll work our way through all 10 of them before it's all said and done. Anyway, David Brownstein finally returning to us on the 28th. Then, although Monday the 31st will be time spent here, we will be moving to November, coming up in a week or so, and our our guest lineup should be, as you would well know by now, Roland Thomas is going to be our guest on the 7th of November. He, of course, is the gentleman who, teaming up with Dr. Michael Kiriak, the Soviet scientist who discovered the bioengineered algae concentrates that we've talked about so frequently here, that we offer as a, I call it the all-inclusive supplement here in the office. It literally replaces 6. One supplement replaces 6, which is a pretty good trade-off, I believe. Especially, even just looking at it economically, it's good. But this bioengineered algae concentrate does so much more than provide supplementation. It's involved in literally reversing malfunction, dysfunction, and disease, first in animal populations, where Dr. Kiriak initially experimented with it, and then finally with the human population that he was called upon to intervene with after the tragic accident of Chernobyl of 1986. The story you've heard about many times, a new twist to the story, one that's in keeping with the this particular century, which is the devastating effects of what appears to be the epidemic of the century. That, of course, is diabetes mellitus, type 2 forms, and Roland, evidently, is going to be speaking about how the supplementation with F3 can be beneficial in reversing that disease. That's on the 7th of November. Then we're going to have Susan Smith-Jones return with us and for November, talking about a topic that is all too timely, because as we move into November, the holidays are around the corner. She's going to be talking about 10 tips to not gain weight over those holidays, and that'll be our discussion with her on that date. So, that's the calendar as I see it today. Enjoyed spending some time with Beth Clay on Wednesday. She is quite a knowledgeable gal in the Washington, D.C. scene, as you have come to know and appreciate her. Originally starting out, as I found out the other day on the show, at NIH itself. She was there at NIH, and from NIH, she moved over and worked with Dan Burton on his Committee on Government Reform for a number of years, and now she's out on her own, a lobbyist herself, working through the aisles of Washington, D.C. with medically related and alternatively medically related items, seemingly spearhead as one would only expect that to be able to do. So I enjoyed spending the time with her. We'll bring her back in January as we find out the status of Obamacare, as we learn more about the Supreme Court weighing in on whether or not the mandate that everybody has to participate by purchasing insurance will yet to be resolved, potentially resolved by the Supreme Court. That'll all be known at least the date. We won't know about the result of the Supreme Court. That won't be until sometime in June, if at all. So it was Beth Clay. She mentioned, did she not? And I always like to give a plug to the new guest we learned with Daniel last week in his Twilight Brigade. What a noble effort. This gentleman who, according to Beth, has been exhaustively involved in helping people approach death with dignity and without fear, and in particular case of the Twilight Brigade, affiliated with the veterans of foreign wars, vets period, who apparently, according to Daniel when he was on the show, are now approaching death at the rate of about 80,000 deaths per month from all the wars, World War II and the Korean conflict and the like, Vietnam. That's a pretty high number and a large task to be able to try to be there for the veteran in those final moments. And we'll bring Daniel back also as the year wears on, and interested in his own personal story, which he wrote 3 books about, and at the time I read him on the show, I didn't even know that. So, good luck, Daniel, with your Twilight Brigade. Putting out a advisory for those that have an interest in an eye treatment seminar. We've had Dr. Edward Condrat, as you would well know him, a Pittsburgher, true to the core. An ophthalmologist who practiced many years here in the Pittsburgh area, but then moved off to Phoenix, Arizona, and now literally goes all over the country, treating eye disorders in a very unique way, his way, a non-conventional way, and frequently, and I do mean frequently, has those treatment seminars here in the Pittsburgh area. Now, last time he was here was in May, and he ran his treatment program right out of my office. He's contemplating coming back in January. He's trying to find out, is there any interest out there by our listeners to be involved in a treatment seminar so as to be able to allow him to schedule that for the month of January. I have no dates. He's right now using this as a feeler to find out if there is interest. So if you do have interest in being a participant in the eye treatment seminars, giving us a call here. We'll then pass that information on to Dr. Condrat and allow that date to move forward. Usually we just need the ball rolling a bit, and by the time the course comes to fruition, we usually have our maximum of 10, which is the cutoff, of course, 10 patients, that is. So Dr. Condrat had asked me to ask you, please give us a call here, 724-942-3002, if you have any interest in that treatment seminar. Okay. MCG testing is back, folks. We just logged in that device with the co-owner of it, Dr. Douglas Summermount out in Donald, Pennsylvania. He carries the machine in his office half of the month. I keep it in my office for half of the month, and a lot of festivities, a lot of testing, and the ability to test without worrying about impinging on Jerry Singleton's schedule. He's been very nice to do this for us since February, but now we're on our own. The dates, for those of you who are listening to me and think they would like to get this kind of testing done, MCG testing, of course, standing for multifunctional cardiogram. It is a 6-minute test which is able to give us valuable information with respect to one's coronary artery status. Pretty sophisticated electronic wizardry now enables us to look into the heart without ever leaving the bedside. A 6-minute test, completely risk-free, is able to give us the same or very similar information to assess the coronary arteries as one would get from a full-blown cardiac catheterization. No one wants you to have a cath, but you might very well want to know what the status for those coronaries are. With 91% accuracy and specificity, or so says the literature that accompanies this device. MCG testing is now a reality here. It will continue to be so. If you'd like to come in and either get your first testing done here in the McMurray office or a repeat test, and those of you who've had them know that where you have had, the 1-year anniversary wouldn't be up yet, but there are plenty of you that might have a 3-month or a 6-month go-ahead to get your additional testing. That can all be done here in the McMurray office on the 10th of November, which is a Thursday. And for those of you out in the eastern part of the Pittsburgh area, specifically Monroeville area, we'll be having a presence in the MedHealth offices of Dr. Caminos starting on Tuesday, November 22nd. So if you do live in the area and felt that traveling all the way to McMurray was difficult, and you'd like to be able to do something in your backyard, please take us up on our offer to allow you to be tested right there in the Monroeville office, which will start on the 22nd, a Tuesday. And we'll be doing them monthly, both here as well as there. The dates will may change, obviously, but our first ones will kick off in the month of November. November 10th, here in my office. Give us a call, 724-942-3002, or November 22nd in the Monroeville office, the MedHealth Services office, the new, brand spanking new building that Dr. Caminos occupies, literally across the street from his previous building, which is now unoccupied. Okay. Another item. How about the HCG testing? We had Dr. Emil Shandel here within the last few weeks, talking about HCG testing for the detection of cancer. It is a highly sensitive test. The HCG, of course, is a human chorionic gonadotropin that is produced by trophoblasts. You're very familiar with it as the pregnancy hormone, certainly produced by the trophoblasts of the embryo itself. But little known and appreciated is the fact that the trophoblasts literally migrate to all regions of the body in utero during embryological development, and it is believed that it is the trophoblastic cell which goes crazy when a lesser oxygen environment below a 35% threshold provokes the formation of, you better believe it, cancer, and consequently can be detected by putting out the same hormone that occurs during pregnancy, but also occurs during the lifespan of cancer. And the interesting thing is that now it can be done in one laboratory. The laboratory is Dr. Emil Schanzel's laboratory in Fort Lauderdale. We are a draw station for that test. So if you're listening to me and think you'd like to be tested, well, various categories of patients, I presume. Those patients who have just fine, doing fine, wondering, gee, do I have a cancer? How could I know early enough? This is one of the ways that you can certainly do it, especially when the sensitivity of this is to detect the presence of HCG being put out by as little as a cluster of 12 cells. Now, the other category, certainly where the cancer has already surfaced at least once, allows for a person with that diagnosis to monitor their cancer during treatment, as well as finally determine at the end of all treatment that this cancer has been beaten, that when the HCG levels would fall to 0, you could interpret that as meaning that you're completely cancer-free. Anyway, HCG testing now available here. We'll just give us a call to come on in and pick up the kit. You've got to do the urine specimen at home. We'll process it, but you'll have to gather the urine specimen at home, and then once we have it, we'll do the blood testing here, because HCG requires 3 tests. Two of them are blood, one of them is urine, and all 3 of them get sent off by us to the testing laboratory in one fell swoop, and allows us to make that determination as to whether cancer is ongoing or detectable in your particular case with a blood test that you in fact can take control of. It does require a doctor's prescription, but of course I will provide that if you should like to be tested. Let's do this. Let's take a short break. When we come back, a little bit more, pick up a little bit more on this trophoblastic theory and the use of pancreatic enzymes. Just came up in one of the calls we had the other day. I want to bring it up to you again. You can take over the show and bring up what you'd like to talk about too at any time. 412-825-6262. We'll do it for you. Be back in a moment. See you then.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KGHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Friday version of the show, traditionally a Get 'em Up, Out of Town version of the show, where we invite you to come in, invite you in to, get it off your chest. If you have a query or a question you want to pose to us, please do so. Be happy to entertain any question is okay. Any comment you'd like to make on what we've been discussing here over these many weeks and days, feel free to give us that call, 412-825-6262. Now, one of the issues that came up, it just came up as a question the other day, but is in keeping with this trophoblastic theory, the fact that trophoblasts are the origination of cancer is gaining quite a foothold in medicine. It's all started back with the work of a Dr. Beard, John Beard, in 1904. And then an embryologist who initially proposed the trophoblastic theory. It was then picked up by Dr. Kelly in the middle part of the 1900s, and now pretty much run with by Dr. Nicholas Gonzalez, a medical doctor out of New York City. He gains noteworthiness because his work is described by Suzanne Summers in her famous book on cancer therapies called Knockout. Anyway, during the discussion that she posted in the book, and the many times I've heard Dr. Gonzalez speak, the trophoblastic theory holds water today. It is apparently an accurate description of where cancers do come from. The HCG testing is the direct result of that trophoblastic origination of cancer, and so happy to be able to bring it to you. But a component of this that gets lost is one of the additional items that Dr. Kelly, not Dr. Beard, but Dr. Kelly devised, which was the fact that he learned that cancer and the cells of cancer tissue is veritably impregnable to immune system activity. It has a very tough and rough, talking about it when I tell you the cells, the cancer cells are very resistant, covering a fibrin coating around the outside of it, and if you're going to be successful in treating cancer, you must attack that coating to make the cancer cells vulnerable to whatever therapy it is you're going to be utilizing, and certainly to allow the immune system to ultimately come in and rescue the day, as it literally has to if cancer is going to be eradicated. So with Dr. Kelly comes the awareness now that another item is necessary in the treatment of cancers, and that is the use of very potent pancreatic enzymes. And these pancreatic enzymes appear to be able to burst through, to cut through, to dissolve this fibrin sheath, this shield that comes up around each of the cancer cells. And so pancreatic enzymes are recommended by Dr. Kelly, now recommended by Dr. Gonzalez, discussed by Suzanne Summers in her book, and of course we certainly use the pancreatic enzyme approach here in the office when dealing with cancers. And the pancreatic enzymes, however, better be ones obtained from New Zealand. Now, you've heard me many times mention this country, New Zealand, who has some interesting rules and laws with respect to animal products that are going to be used for human purposes. And it has to deal with the strict laws, and I mean strict, that deal with any livestock, any animal populations that will be used for human consumption in any way. And if that's the case, they must document, they being the farmers, the livestock owners, must document from birth to slaughter every single item that is in the feed of that animal, no injections allowed, no inoculations. These are the items that keep the animal population pure enough to allow for enzymes that would be recommended by a Dr. Kelly Gonzalez and certainly by me now. So these pancreatic enzymes, which we do make available, would be another ingredient and component to a protocol to treat cancers that heretofore was not really known, and it's nice to be able to pass it on to you. Here we are in a Friday version of the show. We're saying, come on in, give us a knock on the door. Come on in the store. 412-825-6262 is the number to get you involved with what is on your mind. I do have a number of things on mine, and I'll continue to bring them to you. I'll wait for that knock on the door, and then I will let you on at the store. One thing that I've been asked to discuss by a caller who keeps calling our office and says he won't call the show, but he has a question. Would I please answer it? It is dealing with fish oils. Now, it's been a while since I've blasted you with the mantra. Well, what the heck, I'll do it right now. Of course, you do know that fish oil is hazardous to your health. We've had many, many shows, and the proofs are out there. Hopefully you've made the transition now. It's at least 2 months have gone by since we first revealed how harmful fish oils can be to your health. And in terms of what you use to replace it, I've been pretty clear about it too. I'll talk about it in a moment in terms of what the replacement should be, and specifically name brands, because that was the request of the caller. We do have a knock on the door. Let's let them in the store. Come on along. What's on your mind? Go right ahead.
Hello.
Hello.
How are you today?
I'm doing fine. How can I help you?
Okay, I want to talk about lung cancer.
Okay.
Okay, I just lost my fiance to lung cancer recently.
Okay.
And from what I observed, like she first got pneumonia. Okay. They had to treat the pneumonia before they could.
Even know that there was a cancer, huh?
Pardon me?
Normally it works out that pneumonia is one of the first presenting signs of a lung cancer, and then usually they can't even tell that they're dealing with a cancer until the pneumonia is dealt with and cleared. That may have been the case here, it may not have been, but it's certainly common to find pneumonia as the initial and presenting issue when lung cancers are involved. So that's no surprise. I'm very sorry to hear about your fiance, and this lung cancer is a very difficult one, especially utilizing a conventional approach. I'm guessing that maybe that's what exactly was done here.
Right.
Okay. So what do we? Would you like to comment on or ask a question about with respect to lung cancer, sir?
Right. Now, like I said, from what I saw, they had to treat the pneumonia first before they could deal with the cancer. And in this case, the pneumonia, it started in her one lung, and then it spread it to her other lung, and they never really did treat the cancer.
Yeah, I could see where they were really up against a battle, because literally she was drowning in her own fluids. It's
Right.
very difficult to breathe. Obviously, that was the biggest treatment objective at the time, to try to eradicate that. Sorry to hear they never did, because that's one of with respect to cancers, there are three real problem areas. When I hear cancer of either the brain, the liver, or the lung, these are three areas that are very unforgiving. A very small cancer lesion, doesn't have to be very big at all, could produce the pneumonia that you're talking about, and the fluid accumulation that evidently you're describing to us that just takes over within a 48-hour period. Within a 72-hour period, a person goes from walking, talking, breathing, and doing fine to literally utter devastation and near death because of the fluid accumulation being so rapid. So it seems as though that's what's happened here, and I'm very sorry to hear that it was such a rapid course of activity with respect to cancer. And so they only determined it after she died that she had cancer?
Great. What did you say again?
Did they only determined afterwards?
No.
Okay, they knew ahead of time. All right.
Whenever she went in for the pneumonia, they swabbed the mass.
Okay, they swabbed it, got cells, and they knew what they were up against.
Right.
Okay.
Like I said, they were treating the pneumonia. Meanwhile, like the mass was where the cancer was there, and it spread. There's nothing really, from what I could see, there's nothing they could do about it.
Well, no, it's true that as long as pneumonia was a presenting problem, there was an inability to exchange for oxygen, and literally, you might as well refer to it, it looks like a suffocation because you can't oxygenate the blood. It's right. You can't breathe at all. Even though the diaphragm's moving, nothing is getting exchanged. So, pretty gruesome, but unfortunately, it is what happened, and it happens so frequently.
Right.
Lung cancer is involved. Any question or other comments you want to make about it, sir?
I don't know. From what I'm no doctor, but to me, they're going to have another approach where they can do something with the cancer, as well as the pneumonia, because it's like I said, while they're treating the pneumonia, the cancer is spreading. There's nothing they can do about it, and they have to do some research into trying to find something to do about that.
Well, I'm looking right now, holding in my hand, and I've only had it for a couple of months, but whenever the subject of cancer comes up, if I'm talking in my office or now here on the radio show, in 2000, I'm holding out of the Clinical Oncology magazine, the journal, all of the cancers that were detected in 2004. And the reason why I mentioned it 2004 is that 5 years later, they went back to determine how many survivors there were from those that had their cancer detected in 2004, because cancers are usually only measured in 1, 3, and 5 year survival rates. Have you ever heard of those terms before? 1, 3, and 5? Okay. So in the case of lung cancer in 2004, in the entire United States, there were 20,741 cases of lung cancer that were detected in 2004. Of those 20,741, how many were left to survive at least 5 years and 1 day? And the answer to the question is, out of those 20,000, there were 410 people that survived at least 5 years and 1 day. Pretty paltry number, wouldn't you say, sir?
Right.
In fact, the percentage of those that's 2%. 2% of the 20,000 made it for 5 years and 1 day. And that doesn't mean that any of them were cured. That just means they survived 5 years and 1 day. It's a nasty disease.
Yeah.
All the cancers are pretty nasty. Lung is one of the worst, and it is one of the worst for the very reason that you called the show today, to describe someone literally succumbing from pneumonia, because the lung tolerances are so minimal that it only takes a small lesion to provoke the largest accumulation of fluid, and that's what's happened here. I'm very sorry to hear about that, sir. Thanks for sharing it with us. Good luck to you in the future. Okay? Thank you, bud. Yeah, by the way, how about that? 2% with a 5-year survival rate. 2. I can't believe they published it and allowed me to read it. Another knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Hello.
Hi. I wanted to make a request.
Sure.
I think it's Sylvia who's in charge of the Butler meeting group.
Oh, you got a guest in mind for her?
Yeah, Deborah Ray.
Oh, Deborah Ray. And she'd love to come up here, too. And I know that Sylvia knows her rather well. So,
So she's working at that clinic that deals with end-stage diabetes, cancer, all these end-stages diseases. And it'd be wonderful to speak to her
have you been
about her.
following her? What clinic? Is she talking about Dr. Young, Dr. John Young's
I
clinic?
think so, yeah.
Yeah, he's a physician that she sort of teamed up with and goes to his office every week and has been working in his office for a couple of years now.
They got married?
Oh, no.
I thought they got married.
Oh, no, she did get married. She just didn't marry Dr. Young.
Oh, okay.
And I think the person that she married is not a physician. So I'm right about that, okay?
Okay, I thought she married Dr.
No, hey, it was a surprise to me to find out she got married at all, but I know that she works in a doctor's office who she's spoken to me about a lot, Dr. Young, and he's alternatively minded, and they're doing, you say, a lot of end-stage stuff. How are you finding out about her? You get a beat on her somewhere? Are you reading about her?
No, she's your guest.
Yeah, I know, but...
Back, and she said she's working in a clinic.
That's right.
Really is trying to help not only a little bit medically, but most of all nutritionally with end-stage diabetes, cancer, and something else. I can't remember what the third one was, so I just wanted an update, and maybe that would be nice if she could be a guest there. We can informally talk just about her experiences with some of the patients.
You know, she'd be a big hit up there. Everybody remembers Deborah. And, yeah, I can recall her talking about working with Dr. Young. She also, if I can remember correctly, was really happy about how well 3 of her close friends who had cancer literally beat it. Do you remember her talking about that?
I think so.
Yeah, and said so. They did it with that high-dose vitamin C thing, and I felt very good about it because obviously these kinds of protocols are ones I'm heavily involved with too. To find out that 3 of her close friends actually beat cancer by utilizing these alternative protocols made me feel pretty doggone good about it. And you're right. Sylvia listens to this show all the time. She's listening to us right now, I'm sure. And so, Sylvia, there you go. Recommendation for one of your up-and-coming guests at the Freedom of Choice in Cancer Therapy. Good tip. Good recommendation. I hope she takes us up on our idea. Okay?
Do you know if there's still a way to listen to Deborah Ray?
She no longer. No, she doesn't do radio shows anymore. The only thing she does is she is a contributor, writer, and participates with that natural health and cures, naturalhealthandcures.com. I got to look it up.
Okay.
And when you go to the website, she does podcasts. She does interviews for her website, but she doesn't do a radio show anymore.
Okay, that's what I was thinking of then.
Yeah. So you can hear her. She does some interviews, but they're just interviews that get put up on the website. I'll go find that name, by the way, and I'll bring it to everybody's attention because we all like to follow Deborah Ray however we can, and she'd be a wonderful guest up there in Butler. I know. I'd sure come out to see her.
Yeah, I think it would be standing room only.
Yeah, it would be.
Do you know offhand if anyone had taken over all of Dr. Carreau's paperwork and research that he had?
She did. Yeah, I know. Did anyone do it? Yes. Deborah Ray did. And Deborah, and she revealed it on the show the last time we spoke, was compiling and putting together a book that she was going to publish having to deal with all of those papers that she uncovered. And she hit a gold mine there. She realized it for what it was, truly a gold mine, and she was going to publish it. Where she is and all that right now, maybe that could be one of the highlights if she... Well, let's just say this. I'll go find Deborah, and I'll bring her on my radio show at least, all right?
Sounds good.
So we'll bring her on my radio show, and if in the process we can bring her to Pittsburgh, well, we're bringing an old gal back home, an old country girl back home. She'd love to do it, I'm sure.
Okay, sounds good. Doctor.
Great recommendation. Yeah, Deborah Ray. Was supposed to publish that book. Been so long now since we spoke to her. We hear her do these radio spots all the time, but boy, we miss Deborah. Love to have her. Wish she was doing radio again, don't you? All right, we got another knock on the door. Come on in the store. Hello and welcome aboard. What is on your mind?
Hello, Dr. Courtney.
Hi.
I was interested in whatever you suggest for dry eyes.
Dry eye.
I'm already on Lotamax, but I don't want to go that way. But I've been taking the omega-3s instead of this fish oil and some other things. But I wanted to know what you recommend. You probably talked about this, and I listened to your program, but since I didn't have it at the time, it didn't stay with me.
Well, just real quickly, I now refer all my eye questions to my good friend, Dr. Conrad, okay? And I most recently had a discussion with him because I was being asked by patients specifically about cataracts as well as macular degeneration and drops that they could use to help the eye heal. Dry eye was included in that, by the way. So when I asked them about it, I asked them in particular with respect to a formula that's circulating in this month's Second Opinion newsletter by Dr. Robert Rowan. Have you ever heard of Dr. Robert Rowan? Do you know of him at all?
No.
Okay, well, Dr. Rowan is an alternative medicine doctor. He practices in San Francisco, but he does have a letter and a very famous website. And anyway, this past month, he published a eye drop that he touts as being very helpful in the conditions that you're talking about, dry eye just being one of them, all right?
Yes.
And it's a compounded combination of glutathione, vitamin C, and the problematic one for me was DMSO. Are you familiar with DMSO?
Just the name of it.
Yeah, well, it's a solvent that gets used quite a bit, by the way, in veterinary practices where they rub things on the skin and have them able to get into the bloodstream. Anyway, Dr. Rowan suggested a mixture of glutathione, vitamin C, and DMSO. He actually put the entire formula right in his newsletter, and I asked Dr. Conrad about it, and here's the way he answered. So here's how I'll answer you, okay? He said, this particular preparation would not be a problem at all, would not harm anybody, and could potentially help them as long as they had been evaluated by an ophthalmologist to make certain that there were no problems going on at the level of the retina. So, dry eye does not appear to be a problem that has a retinal component to it at all. So dry eye is one of these that I think is pretty safe to be able to use these drops for. It's whenever you get the cataract formation and other things like that, that it would be a problem just to willy-nilly start putting an eye drop in without having a correct exclusion of any retinal diseases. But
no, I've been checked. I don't have anything but this, and it became severe. So I just thought I'd try the natural as much as I could, and I might be eliminating, not using something.
Well, you couldn't get much more natural if you take the three ingredients. DMSO. The three ingredients are glutathione, vitamin C, and DMSO. And so the glutathione, your body's own natural antioxidant, certainly is natural. Vitamin C, pretty doggone natural. The DMSO component is only used to help penetrate the eye itself. And it's a solvent that acts as a vehicle to transport those two other items directly into the eye. So as long as there is no retinal issue going on, you appear to know very well, in your case, that there is not, then you should consider this mixture of glutathione, vitamin C, and DMSO. You'll have to come in.
Now, is this something that you can get?
No,
you already, or
have to have it.
I get these three signaling.
You'll have to have it compounded. Compounding pharmacist. A prescription will have to be written, and if you come on in, we can handle that and take care of it for you. Okay?
Okay, I've been a patient of yours. It's been a while in the past.
Well, come on back.
I appreciate this.
All right.
Thank you.
Very good. All right. Questions about the eye? Yes, I yield to Dr. Conrad on this all the time now, and he's provided me with some good information that I'm happy to pass on to you. Quickly, another knock on the door. Come on in the store alone. Welcome aboard. What's on your mind, sir? Ma'am?
Hello, Dr. Courtney.
Yes, sir. Go right ahead.
I have a question concerning the EFAs again, okay?
Uh-huh.
Our forefathers take instead of, let's face it, they didn't supplement with anything. To get the correct amount of omega-6s and omega-3s, what was in their diet that we don't have?
I love this question because I'm going to love the answer. Here's what was in their diet, okay? Because you're talking about forefathers, you mean generations before you, right?
Exactly, my father's or whatever,
Yeah, okay. So the most healthy way to get the correct doses of omega-3s and omega-6s is unbelievably to be found in grass-fed beef. How about that?
Okay, that's...
Now, why would that be? Just follow with me just a moment, okay? In terms of the omega-6s, you can always get the omega-6s from animal fat, right? From animal ingestion. So that was something that, in fact, we were told that our diet was so overloaded with omega-6s that that's why we better get omega-3s, because we were too stacked in favor of the omega-6s, right?
Right.
So that made some sense, and that's what started us off on this completely out of proportion consumption of omega-3s in the forms of fish oil, which I have now hopefully eradicated in terms of letting you know that this is extremely hazardous to your health. But what about these omega-3 sources I just commented on a moment ago? If you look at it this way, fruits and vegetables carry a lot of omega-3 fatty acids within the very makeup and matrix of the plant itself. Yet, because they're bound up, these nutrients are bound up in the very fiber of those substances, the fiber is not digested very well at all. In fact, very poorly digested. And what will occur is that those nutrients and those fats that are found within the plants themselves that you eat, fruits and vegetables, they end up leaving the body completely undigested, and you never get any of those omega-3. You have one stomach. You can't process that fiber in one stomach. The only animal that seems to be able to do it without any difficulty is a cow, and a cow has 4 stomachs. And by the time the nutrient-laden plant substances pass from 1 to 2 to 3 to the 4th stomach, all of the ingredients, all the nutrients, all of the omega-3 fats are all released from the fibers and are passed into the bloodstream, and from the bloodstream go directly to the carcass of the animal, so that when you eat grass-fed beef, yes, you're getting omega-6s, which you certainly understood that you could get, but you're going to be getting all the omega-3s from the plant sources that you can't possibly get by you eating the plants themselves. So I answered your question, and then I explained the answer. How well is that answer sitting with you? That is the correct answer, by the way.
That's very good, thank you.
Okay, very good. Glad to be able to bring it to you. I love that description about grass-fed beef as being the ideal food. It is the ideal food. Now, you can't get it at Giant Eagle, but you can get it if you go look for it. We got another knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind?
Dr. Courtney, hi, it's Jerry.
Hi.
Question on eye drops and dry eyes.
Yeah.
Two things. I remember reading years ago that supplementing with pantothenic acid can help with dry eyes. I think I read that in Dr. Murray's Encyclopedia on Natural Health.
Vitamin B5, pantothenic acid.
But then the other thing I wanted to mention more specifically regarding eye drops is, the L-carnitine eye drops. And if your listeners do an online Google search, the drops that I got from my father-in-law for cataracts were the, I think they're can C, as in the letter C, a cat. They're L-carnitine eye drops. They were formulated or originally made by the Russian doctor who...
Yeah, isn't that N-acetylcarnicine? Carnicine.
Right.
Carnicine, not carnitine. Carnicine.
Right.
Yeah.
Carnicine. Yeah, that's correct.
Carnicine.
And my father-in-law has used those eye drops. They're actually marketed as a wetting agent for dry eyes, but, they're really being sold, I think it's primarily for people with cataracts, but they're being marketed and sold as a wetting agent for dry eyes. And he's been very happy with them. He's in his 70s. His eye doctor told him 2 years ago that he had to have cataract surgery. He was very skeptical when I told him about the eye drops. I got them for him. After taking them for about 6 months, I said, "How are your eyes? How are you doing?" And he said, "Oh, they're not really doing, anything for me. I don't see anything happening." And so later in conversation, the same evening, I heard him tell somebody else that lately he's been having this problem because his eyesight has improved, and he can't wear his glasses when he drives any longer. and so I asked him, I said, "You told me a little while ago that your eyes hadn't improved." And I said, "But now you're saying that you're in your mid-70s and you have to drive without your eyeglasses when formerly you had to have eyeglasses to see long distance." And he says, "Well, I didn't really think about the eye drops helping with that." And so now it's been over a year. His cataracts have actually, condition has improved.
That's super.
And enough such that he has not had to have the surgery.
Well, we were the first to bring that product to you. That was originally sold by the Vitamin Research Group out in Nevada, and they couldn't get it anymore. And we had to get the stuff all the way from England that we actually sold. It was N-acetylcarnosine, and are you still available today? Are you still able to get it?
Yeah, we order it online, and
wonderful.
No problem.
Okay, so it's another good recommendation.
Under the name of, I think it's CAN-C, if I remember correctly. It's been a while. It's something like that. I might have it, flip it around. It might be C-CAN or CAN-C, but yeah, we've had no problem ordering it online.
Well, thank you. The listener thanks you, and that was the old recommendation that I brought to your attention a while back, and I certainly remember it well. I just brought in the new recommendation because I had a chance to talk to Dr. Condrut recently. Either of those two will be helpful, ma'am. Hope you enjoy the additional help from our listeners. Keep on listening out there, folks. Okay, very good. With just a minute or two to go here, I want to mention, because I had started it, and then we're going to knock on the door, and that is this thing about what to supplement the fatty acids with. You're very familiar with the product that I claim I think should do the job, and that is the fact that there's a product called 4-to-1. It's a ratio of omega-6s in this ratio of 4-to-1 of the 6s to 1s. Linoleic alpha-linolenic. I say that is the product to use because that product has been developed with scientific literature as the basis for coming up with the 4-to-1 ratio. Now, there were two other products that were mentioned here, and one was Udo's oil, and I commended Udo because back when there was no scientific literature at all, Udo knew at least to put these various things in a mixture, in a blend. I don't know what his ratio was, but I'm pretty sure that the ratio was not determined by any scientific literature at the time because there was no scientific literature for him to use as a guide. So I tip my hat to Udo. I say Udo was always right. It was going to be a blend. As to what that blend is and how accurate that may be, I think that there would be error there because it wasn't determined by the literature at all. Yehuda was the doctor who helped solidify that 4-to-1 ratio. That was done by scientific research, and that was done in 1994. The other product that I mentioned is a product line called Yes, Y-E-S, and they have a whole number of products. One in particular was the oils, and there are 5 oils found in this product called Yes, and they don't appear to be in any scientific ratios that I can see. Now, they're parent oils. They are in the omega-3 and the omega-6 line, and as parents, they certainly are the right ingredients, but because the proportionality has not been determined by the scientific literature, I hesitate to utilize it. But those are the 3 product lines, being Yes, the Yes line, which has all parent oils, just in not the right proportion, There's the Udo's oil line, which has plant-derived sources. Some are parent oils, some aren't. And then finally, the product made by Body Bio, Edward Kane and Patricia Kane. They've been making it since 1995, and that's called 4-to-1 oil. That is a ratio of omega-6s to omega-3s in 4-to-1 ratio. Linoleic, the alpha-linolenic. In the linoleic category, there would be sunflower, primrose, and safflower oil. And in the omega-3 side, the 4-to-1 ratio, the components there would be flax oil. And so that's what we've settled on. And I think it's good scientific reason for settling on them. However, all the other oils certainly would be healthy. It's the fish oil that's not. And so might as well mention that as we bring this to a close today. Yes, it is true. Fish oil can be completely hazardous to your health. All right. We're in the background. We're coming right up to the gun component of the show. They're going to be banging on those bongos in just a moment. Don't forget on Monday, Lou Paradise is going to be with us, saying goodbye to pain pills and goodbye to side effects. You'll be talking with Lou on Monday. Don't forget also, next week, we get the guest that you get up at the Freedom of Choice and Cancer Therapy Group. Her name is Janet McKee. She'll be our guest on Wednesday. David Brownstein on Friday. MCG testing coming up in the month of November. Hey, you all have a great weekend. It's supposed to be bright out there. I'll see you bright-eyed and bushy-tailed on Monday morning. So long.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group.